By ladies, I mean Beth. Professor Wazelenko has graciously agreed to speak to us today, but he has also been helping out the city of Syracuse with our Ravage Commission and providing us information as we go in these unprecedented fiscal times, which we talked about this afternoon. So I took the liberty of asking him to talk to us this afternoon about what is going on with other municipalities and in other places. So, Mike?
Thank you.
Thank you.
Thank you, Mayor. Yes, and the cities I've chosen to talk about weren't taken at random. Mayor Miner said, why don't you look into these particular places? And once I started looking into them, I figured out why. I'm going to focus mainly on pension and health costs in these cities. And you'll see why in a second. We're going to talk about Providence, San Diego, San Jose, and Detroit. And let me show you why. First of all, I always like to go back and see what Einstein said about problems. We can't solve the problems we have by using the same kind of thinking we used when we created these problems. So, I think the discussion here has kind of lent itself to that. We got to think differently about what we're doing rather than, try to work with the same old system. And the other thing he said that's relevant here is the most powerful force in the universe. This is in response to a question that someone asked him, what's the most powerful force in the universe? He said compound interest. And in many ways, that's what we're facing here. We've got people on retirement programs and health programs that are growing at some COLAs are growing at 6% a year in some of these cities, 3%. People are living much longer than we expected when we got into these sort of contracts and defined benefit plans, say 20 or 30 years ago. And so you're compounding these things over a longer period of time, and that's just growing astronomically. This is not unique to cities or states. Federal health care is growing at those leaps and bounds for Medicare and other programs as well. So, this is not a unique problem, and it doesn't have a unique answer either. So every city's a little different. I don't think that what was done in these cities is necessarily something you need to do, but I think it's instructive to look through them. Basically, pension and health care costs, as you well know, are growing faster than income in cities and property taxes. And so we face a dilemma where these costs are growing much faster than any prospect for revenue to catch up with them. And what do? People are retiring at younger and younger ages, not older and older ages, and they're just living a longer period of time and collecting these pension and health benefits for a much longer period of time. So we don't require, I think, enough contributions from employees for these, and you'll see some of these cities have changed how they're thinking about that, requiring employees to make stronger contributions to their own pension plans, even if they're defined plans, making stronger contributions to health care if they want to stay on the health care options that they've had until now. And sometimes we do, and I've heard some of this in here, we wait till there's a crisis. We do what we need to do from year to year. We know there's something out there looming, and I think Mayor Miner, summed it up well when she said, should I wait until there's really a problem in 2015, or should I try to address it now? And I have my own private answer to that, but who cares? Some history here. This is not a unique and new issue. New York City has already been intimated, faced some of this challenge early on in the 70s and 80s. And there was a quote, this is from the New York Times in October 1987. New York City's public employee pensions have made a strong recovery since their financial soundness was seriously questioned in the early 70s, according to a consensus of experts and public officials who monitor and administer these systems. So much so that article went on to say that we're just going to sit back and let these funds accrue, and we'll be able to just pay the pension costs out of the earnings from the assets. Well, there was another associate dean who stood, not here because this building wasn't here, but in this area, and he said, I sort of doubt that. He could not see how the assets would be sufficient to cover the benefits of city employees hired after the turn of the century. And that was, Bernard Jump said that. But then Mr. Golden responded and said his prediction was based on the steady improvement shown by all 5 systems in their proportion of assets to liabilities from 51% to 67.6% from 67 to 86. Strong performance, but kind of the old thinking that, these, whatever happened in the last few years will go on forever. And, we know what happens when we think that way. So my point here is not that New York City has problems, but that these issues have deep roots. These aren't something that, yesterday reared their heads and we all of a sudden have to pay attention to them. There's some new directions, as we started by saying. We're at a tough environment. There's many of you face, citizens don't want to pay new taxes at all levels of government. We have shrinking tax bases and not growing tax bases. And we have an investment market when we invest pension funds and other funds that really isn't doing that well. I mean, it's okay. It's recovered from the 2009 disruption, but the last few years have been sort of modest growth at best. We're not even seeing 8-9%, which is some of the projections on the pension funds are based on rather robust returns to assets. Some cities have cut pensions and health costs that they pay. They've changed. Change requires bringing many stakeholders together, as you well know. Unions, public, retirees, city council, media, courts, and other interest groups. And you'll see a lot of this in what I present for some of these cities. I've talked to some of the policy directors in the cities, and they all told me that these are tough fights. And they're not done. And the courts get into it, and there's arbitration and so on. These are things, but one thing I want to talk about, and one thing the school stands for, is we got to be mindful to respect public employees and continue to attract them to some of the toughest jobs, I think, in the world. So, it's not about going after them per se. These are decisions that were made a long time ago, and they just have to be part of the solution for us. Let me talk a little bit about the city of Providence, which is more akin in size, I think, to what Syracuse and some other smaller cities here, not Yonkers, of course. They had large structural deficits in their health and retiree health and pension funds. They had COLAs for police and fire of 5 to 6% a year since the 1990s. So this is part of the compounding here. They were doing in many cases, so the director told me, better than the employees in terms of raises, and people on retirement were, making very good money. They had a lifetime health insurance coverage for employee and spouse with a minimal copay of $400 a year. Pretty good. The health plan funding ratio was 0.07%, and they're $1 trillion unfunded. So this is this liability that they're facing. The pension plan was funded at 34%. They had $0.8 billion unfunded. And the Providence annual budget, just to put all this in some perspective, is $638 million. That doesn't count the school district. So, big problem, right? They have a budget shortfall in schools, a budget shortfall in the city. They have, for them, a fairly sizable nonprofit sector where they're not getting much taxes. I will come back to this. They have the hospitals, Brown University, the Rhode Island School of Design, and Providence College. They can't afford to fund the current pensions and retiree health care plan. There's just no way out of this. So they decided to work with new hires, current employees and retirees to reduce the unfunded liabilities. And we're going to see what they did in a second. They're going to find money to fund the annual new liabilities, if not reduce underfunding. So that's this is sort of objective here. So let's take current retirees. What did they do? Well, and the director told me, I said, what was the motivation for getting the retirees to give you concessions? And he said, well, first of all, the state had reformed their pension plan a bit earlier, and Rhode Island's, as you know, a pretty small place. And there was another city in Rhode Island that declared bankruptcy and wiped out the pension plans. So this kind of got the attention of the retirees. But he said, it's not all done. We're not done yet. But they're going to suspend the COLA increase for 11 years and eliminate the 5 to 6% for good. If the COLAs do come back, they'll come back in 2023, and there may be 2 or 3%. That was what they negotiated. They're going to cap pensions at either 150% of the state's median household income. I left the word median out there, sorry. Or $82,000 in 2012. Or the salary of a current worker at the same rank, whichever's lower. So the state median family income is $82,000, median household income rather. And if the current worker at the same rank for the retiree, that salary's lower, that's your cap. All right? Seems kind of reasonable. They're going to reinstate the COLA, as I said, at 3%. For those under it's 150% of the household income cap. And then they're going to move eligible retirees to Medicare. And the city will pay for the retirees' costs of coverage for Parts B and D of Medicare. That's the hospital, that's the physicians and the drug programs for Medicare. Prior to that, the employees didn't go into help Medicare at all. They stayed on this drastically unfunded health care plan. So you'll see this theme on the Medicare part throughout. I take it from some of the conversation that our employees are eligible to go into Medicare at some point. But this is a pretty dramatic change, especially the COLAs and the caps on the pensions. The goal for the city of Providence is to get the 70% funded pension plan. Most experts think, most actuaries will tell me anyway, that they consider the 70 to 80% funding is sort of adequate. Current employees will have retirement calculated on the 4 highest years of earnings instead of the 3 highest years of earnings. That's a concession for current employees, and they'll fall into the same COLAs and caps on the pension plan as current retirees. The city worked with some of the nonprofits to increase their payment in lieu of taxes. And also the director told me that the state of Rhode Island has a pilot for state property. So the state will put in some payment in lieu of taxes for state properties in the city of Providence and other areas around the state. Brown University has agreed to put in an additional $31.5 million over 11 years, and it already contributes $4 million. There's some of the other nonprofits have done some more. The total for the nonprofit contribution in extra is $6.5 million a year. It's a $638 million budget. That doesn't make a big dent, right? But it's something. I think they sort of get the spirit of this moving ahead a little bit. That's what Providence did. So pretty big changes. I think the big change is capping the pension plan and drastically modifying or even delaying or eliminating the COLAs. We'll see where that goes. This is still pending in the court. This is not all fully agreed to yet, but they think they're going to get it because, it's subject to challenge, but they think it'll go through because of all the problems at the state level and also problems at the city that's going bankrupt. I think it might be instructive to look at the federal retirement, the system for retirement of federal employees. This was reformed a long time ago in the 1980s. And federal employees were on a defined pension plan, was based very much like what state and local employees have now. Defined pension based on years of service and sort of a built-in COLA. They went to something, what they call a three-pronged program. First of all, they got the federal employees into Social Security, so that's part of the retirement plan. There's an employee 403K type contribution plan, so there's a defined contribution that the employee makes. And there's a modified federal employee defined benefit plan based primarily on the employee's Social Security benefit. So you get the defined plan for the feds based on what your Social Security payment is. So it's an incentive to sort of get in that system, and you'll see some of this structure in some of the cities that I'm going to propose here. I think the main theme for the rest of the cities will be that the employees have to contribute more to stay on these pension plans. We just need more contribution from employees. Let's look at the city of San Jose. Their pension funds for police and...
You talked about it in that last column there, is that's the payment that's required of the employee. That's the third bullet.
This third bullet, there's no required payment for the employee, no.
So the benefit they get is defined by the Social Security?
It's based on the Social Security benefit, yes. Not on years of service. Okay. San Jose, the pensions for police and fire are relatively well funded, 79%. City employee pensions are 69% funded. So, okay. City contributions to finance future pensions, however, amount to 50% of the police and fire payroll. I heard the word sustainability used here. This is not sustainable. And the city contributions to finance city workers' pension fund amount to 28% of payroll. So, 79% funded sounds pretty good. The contributions to maintain that funding level don't sound so sustainable. And the COLA there is 3% per annum, modest compared to Providence. Health insurance coverage for retirees. Retirees pay no premiums for coverage under a $25 copay plan. Police and fire post-retirement benefits. This is for health care, basically dental and a few other things. 6.2% funded, a almost $900 million gap there. City workers' health post-retirement benefits, 11.7% funded, almost $1 billion gap there as well. And the city budget's $1.7 billion, just to put it in perspective. Not sustainable. Some of the problems that some couple California cities are facing. So they felt a need to do something. What did they do? Well, for current retirees, they said there's no change in the pension system. It's funded. We'll just keep you moving ahead on the system we have. We're going to have to start doing something about health care, however, and starting in 2013, for retirees under the age of 65, they introduced a new deductible health care plan added. And retirees who are under 65 may enroll in the new health care plan at no cost, or stay in the plan they have and pay the difference between the premium for the new plan and the existing plan. So if you want to stay, fine, you just pay the difference, the actuarial difference. Fair. Retirees age 65 or older enroll in Medicare and choose one of the city's Medicare supplemental health insurance plans. So Medicare is a big part of the change here. even for current retirees on health, where they face the biggest problems. And, you'll see what they do for new employees is a little different. For new employees, they're going to go to something similar to the federal government plan. Did you have your hand up? No. Okay. Social Security, an employee contribution plan, and a modified benefit plan called Plan B, which is a little different from the Plan B that Mayor Minor pointed out to you.
That was the B team.
Yeah, B team, sorry. The Plan B plan in San Jose is you accrue benefits at 2% per year of service, not more than that, and you max 65% of the three highest years of pay. So there's cities beginning to cap what you can get for pensions. You can retire at age 60 after 10 years of service, and the COLA is 1.5%. The actuarial costs of Plan B, this is important, are shared 50-50 between the city and the employee. So the employee is actually contributing 50% of the retirement costs. And that's usually a big change. And I think part of the theme here is you got to get the employees to pay more of their fringe benefits, a theme I heard you talk about. Okay, what about current employees? Keep the pensions. Oh, sorry, did I go backwards? Sorry. Current employees keep pension benefits that they have already accrued. So if you've been working there 20 years, and you've accumulated 2% times 20, based on your three highest years of earnings, you keep that. It's funded anyway, but just stay there. However, going forward, you can choose between staying with the current pension plan or you can opt into Plan B, which we just talked about. If you stay with the current plan, you have to contribute 4% of your salary in year 1, 8% in year 2, 12% in year 3, 16% in year 4, and thereafter. Now, the idea is to transition to a higher contribution for staying with the current pension plan. Again, same idea, employees have to pay more to stay in, but they'll pay no more than 50% of the unfunded liability for their own plan. So 50-50, and you work your way up to that. This is in addition to the current contributions they make. They also could opt into modified Plan B, that is more generous, is slightly more generous than the Plan B for new employees. Modified Plan B is more generous yet to firefighters than for city workers, police and firefighters. The modified is a maximum of 75% instead of 65% of the three highest years of pay for city workers and a max of 90% for police and firefighters. There's obviously an earlier retirement age for police and firefighters as well. So, they're helping out a little bit with the modified plan, basically some compromise, but you've got to contribute some more money out of your pay. Stay with it. We need more of a contribution. Revenue enhancers for San Jose, something not everybody has available to them. There's an increase in the marijuana tax. This is the medical marijuana. Take it easy. And they're raising water and sewer rates. But, there's, again, not a lot of opportunity there to raise more revenue. I think you got to get more concessions from some of the public employees and basically to get them to pay for post-retirement benefits. Let's look at San Diego, a much bigger city than us up here anyway. City pensions are funded at 68%. City contributions, however, are $239 million a year and are growing to support the current system. You can see San Jose's annual budget is $1.2 billion. That's still a pretty substantial contribution compared to their budget, just to keep the city contributions for the pension plans. So the contribution rates aren't sustainable. The COLA is 3% per year. There's a $1.1 billion unfunded liability for retiree health care. And the group of employees hired between, here's a complication here. I don't know if some of you may remember Mayor Pete Wilson, who was a bit of a maverick. He hired workers between 1972 and 86. He got them all out of Medicare. So you can't use the Medicare option for those employees. They're not in the system. So that creates a little bit of a different, this kind of illustrates some of the complexities, I think, and some of the flexibility that one needs to have to find some of these solutions. Those employees hadn't either worked at the city long enough to qualify for Medicare coverage when workers were voted out of the system, or began working when the city wasn't participating in it. So this complicates health care reform for the city, but you'll see what they do to get around it. Current pension system, safety employees eligible at 55, age 55, with 10 years of service. Other employees are eligible at age 62 with 10 years of service. General workers, which are those others, can earn pension benefits up to 80% of the highest consecutive 36 months of compensation. Safety employees up to 90%. General employees contribute between 7 and 12.5% of salary, depending on the age at which they were hired. So if you're hired very young, you pay a lower rate, but for a longer period of time. If you're hired later on in your career, you pay a higher rate for a shorter period of time. But somehow or another, they get actuarially kind of a sound contribution system for all the employees. Not actuarially sound to pay for everything, but actuarially the same contributions for what you're eligible for benefits. Safety employees contribute because they have a much more generous plan, between 13 and 20%. Again, people get in a younger age and pay a lower rate because they pay for a longer period of time. And there are two pension tiers, those hired before 2009 and those hired after 2009. I frankly don't understand all the complexities myself, but won't get into them because there's different contribution rates, pre and post, and they're trying to hold down the contribution but making the pension slightly less advantageous. Let's talk about pension reform. Current employee and retiree pension benefits won't be changed. So if you're already working there or you're already retired, you're not going to change your pension. Keep going. Health care for retirees not eligible for Medicare. That group in the 72 to 86 group. Workers close to retirement are going to pay $1,200 per year and receive $8,800 a year that they can use to purchase health insurance. That's not going to buy you a Cadillac plan. Younger workers are going to pay $600 per year and receive $5,500 annually, or upon retirement, you may take a lump sum of $100,000 when they retire. So for younger workers, that's indexed obviously, but basically that's not going to be enough to cover health care insurance. You're going to have to get into the Medicare system or something later on.
I'm sorry. So workers close to retirement pay $1,200 and then receive $8,800 annually?
Right, to purchase their own health insurance.
Why would they make a contract? Why would they just receive $7,600 annually? What are they paying into?
It depends how long you're going to make this contribution, yes. They're paying into a fund. That's a good question to ask them. Why not give them $7,600? That's what they were able to negotiate, I guess. These are for people not eligible for Medicare only. It's a small group, or smaller group. Sorry. Okay, clicker. The new pension system, these are for newly hired workers. It's very different. New safety employees stay on a defined pension plan but can earn pension benefit up to the 80% of the highest consecutive 36 months of compensation. Again, they're making a fairly large contribution, between 13 and say 20% of their salaries annually. New general employees receive a defined contribution 403K plan. The city contributes up to 9.2% of salary, and the employee matches. So basically got out of the defined contribution plan for new city employees. Police and fire, I think, a tougher negotiation. Stay with the defined plan, up the contribution rates. There's also a payroll freeze for 5 years. Payroll, not necessarily wage and salary, so you can trade off between how many employees you have and how much they make, what kind of salary increases they get. In response to lawsuits, there's a temporary restraining order on all these changes, and the judge is going to rule in late July. I believe July 27th was the date I heard. But this is not done. And the Providence person told me there's a challenge in Providence too. These are going to be hard-fought issues. So the changes are not yet enacted. Talk a little bit about the city of Detroit, a much more complicated arrangement. I think people have heard enough about Detroit to know that it is in fairly dire straits. Mayor Bing is a graduate of Syracuse University, as you know, one of our famous alums, in fact. So we are very much interested in what happens in Detroit. Anyway, I was glad to see this on Mayor Minor's list. They have large budget deficits. They have decreasing amounts of property taxes. I mean, their property tax revenues actually fell by a lot. As you know, he's talking about taking properties off the rolls, about bulldozing properties that really aren't on the rolls anyway. It's a real dilemma up there what to do about these neighborhoods and so on. They've frozen wages and proposed reductions, and they propose reductions in pay, 10%. There's reductions in capital spending of 75%, so they're not building anything, not investing anything. The mayor said, this is where I can cut my budget, this is where I'm going to cut. So it's not a healthy situation. Sorry about the fine print. The retirement plans are funded at 80 to 90%, but there's a little wrinkle there. The assets stand at $3 billion in the latest figures I could get, but $1.2 billion of those dollars is in pension obligation bonds towards the unfunded liabilities of the police and fire pensions. Now, it's sort of an interesting way to do this. What they did was they borrowed money at between 4.4 and 4.9%, because they borrowed it over time, up to $1.2 billion. So they have these bonds. They're paying off the bonds and investing the $1.2 billion and hoping to make more than 4.9%. They're doing, actually on net, they're doing okay. A lot of this borrowing occurred in 2006 and 2007, and 2009 wasn't such a good year for investments. So, that was a tough thing to swallow. But overall, I think it's recovered enough to where they're net positive. But I think you have to be able to survive these downturns. So having a set of assets that's let's say $1.8 billion as a cushion to fund your liabilities in those down years helps. Borrowing even more cheaply than 4% would help, and earning, somewhat better earnings over time would help. But I think the caution here is doing what I think it's Stockton, California did, is they borrowed money, invested it in very risky assets, and it didn't pay off. So, they're basically underwater here, going bankrupt. So you got to be careful with this tool, I think. It's not for everyone. If you have substantial borrowing costs and zero funding in your pension, I wouldn't recommend it at all. You need some cushion here. The city retirement contribution for police and fire is still 28% of payroll, despite this 80 to 90% funded level. They were able to get concessions on retirement pensions. Post-retirement health care benefits are on a pay-as-you-go basis. There's no actuarial funding at all. There's a $5 billion deficit or unfunded liability on a budget that's $1.1 billion. For the city, that's $3 billion if you include enterprises like the airport and some other things. They call them business enterprises. But, you know, this kind of gets your attention, and the contribution rate for current workers is also pretty heavy. Here's what the retirement system looks like for police and fire. You're eligible after 25 years of service. It's 2.5% per year for the first 25 years, times your average compensation in the last year, plus 2.1% times your average compensation in the years greater than 25. So if you serve 35 years, you get 2.5% times 25 years, and 2.1% times the next 10 years. So you keep accumulating, but at a lower rate. General employees earn retirement benefits based on the years of service and final compensation as well. They also contribute to an annuity fund, this is optional, and draw on that in retirement in addition to the defined pension plan. It's not quite as generous as the police and firefighters, but still a defined contribution plan. Here's the concessions. Police and fire agreed that current employees will reduce their pension earnings to 2.1% multiplier from 2.5 for all years of service after September 1st, 2011. So you don't have to wait to 25 years to start getting the 2.1. That starts for any years earned after September 1st, 2011. Modest, but for younger employees, might make a big difference. Officers hired after 7/1/12, July this month, will participate in a defined contribution plan. The city will contribute 10% of salary. So basically, the new officers will have a defined contribution plan. They're off the defined benefit. So the city of Detroit's out of this business, starting with new employees. Big change, huge change. Healthcare post-retirement, the city pays health insurance, dental, and more for employee and the spouse only if she draws a city pension as well, or he or she draws a city pension. For retirees not eligible for Medicare, so you already flip into Medicare in this system. Retiree contributes 10% of the premium. Once Medicare eligible, the city pays for a complimentary supplemental health insurance. This is the second or third time we've seen this. Health insurance obligations paid on a pay-as-you-go basis. Again, there's no liability. The GASP accounting requires reporting unfunded liability of $5 billion for post-retirement health care. These are serious financial problems. The Citizens Council of Michigan, I'll point this out, has a series of publications that is very good, and they have one on the legacy, costs, and indebtedness of the city of Detroit, but they look at a variety of, this is a good website, and a lot of interesting research done on cities and other local entities in Michigan. So that's one of the reports I was able to pull up. So at least in these cases, cities are trying to realign their pension and health care costs for retirees. They still face significant challenges to finding new revenues. Reducing expenses has received priority, and wage and salary freezes and reductions in staff are not uncommon in these particular areas. It's not a pretty picture, and I sympathize with a lot of what's been said here, that, these are just beating up on these employees is not a good answer. We need these services. We need to find ways to finance them. They need to be part of the solution. I don't think there's any way around that. This stuff has come crashing down on us, frankly, at all levels of government. We are facing huge challenges in the Medicare program. You all know that. At the federal level, all of you know, aware of the fiscal cliff and all the challenges we face there. This is just going to have to be dealt with one way or the other, and we've got to deal with it at this level. I will put in a plug for one thing I've heard here for education. I think cities who are not, the students who are not graduating high school or not even getting a good education if they do graduate, that is a fundamental, maybe the most fundamental problem we face as a nation. I fully sympathize with this idea of getting to children early. Head Start is one of our most successful programs. There's people in the school who study primary and secondary education that have long said, we ought to address city schools as a priority. Maybe we'll get around to that. That's also got to be part of our thinking. Thank you very much. If there are any questions, I'd be happy to try to answer them. Thank you.
So let me just do a couple of housekeeping items again. I'm full of housekeeping. That's not because I'm the only female mayor. We've had a great deal of interest from the media